Have you walked out of the doctor's office and realized you didn't ask an important question? Or maybe you agreed to a test or medication that you fully didn't understand just to keep things moving? You're not alone. Most people don't realize that the quality of their care depends on the quality of their question. If you don't ask, you might end up with unnecessary tests, more expensive prescriptions, or treatment that doesn't fit your needs. Doctors mean well, but they're busy, and appointments are brief. And if you don't speak up, important information can get missed. In this module, I'll give you the exact questions to ask your doctor that saves you time, money, and stress, helping you truly get the care that fits you. So, on this module's agenda, we will be learning about questions about tests, questions about prescriptions, questions about procedures and referrals, questions about alternatives, pro tips for asking effectively, quick question checklist, an example, the power of asking, pro tip roundup, and closing and next step. Have you ever had a doctor order blood work or an x-ray or even a MRI and you weren't totally sure why? You probably thought, well, they must know what's best, but not every test is truly necessary, and many come with extra costs that you could avoid. That's why it's important to ask clear questions before agreeing to any test. So let's start with medical tests because that's where a lot of unnecessary costs and confusion happen. So before agreeing to any test, ask three questions. Why do I need this test right now? What will the results change about my care? And is there less expensive or less invasive option? These questions help you confirm whether the test is essential or just a routine habit. So, an example of questions about tests: Jennifer's doctor suggested an MRI for back pain after one visit. She asked, will the results change my treatment? The doctor said, not right now. Let's try physical therapy first. She avoided unnecessary scans and the costs associated with it. And if a test is necessary, still ask, where can I get this in network? Again, in network saves you a lot more money than out of network. And also ask, can you send it to a lower cost lab or outpatient imaging center? Typically, outpatient imaging center are cheaper, and hospital-based labs and images are often more pricier than freestanding clinics. Your goal isn't to refuse care, it's to make sure every test actually helps you get better. Have you ever been shocked at the pharmacy counter when you heard the total for your prescription? Or maybe left wondering if there was a cheaper or simpler alternative? Medication costs are one of the most common and most preventable sources of waste spending in healthcare. Let's look at a few questions that can help you save big without sacrificing quality. So, medication costs are a major pain point, but you have more control than you think. Before accepting a new prescription, ask these questions. Is there a generic version of this? Do I need this long term or just short term? Are there non medication options that could work first? Now, here's an example. Robert's brand name cholesterol medicine costs $180 a month. He asked about generics and was switched to another version of the brand name for about $10. Same effect, far lower cost. And here's a pro tip: if your doctor says no generic, ask whether there's a therapeutic equivalent. a different drug in the same class, just different options. They may know what is available. If they don't know the pricing, check GoodRx or Single Care for current pharmacy quotes. Now, did you know per FDA standards, US generics have the same ingredients, strength, and quality and effectiveness as the brand name drug? So asking costs nothing, but not asking can cost hundreds each month. Has your doctor ever mentioned surgery, referred you to a specialist, or ordered a procedure that made you pause, but you didn't know what to ask next? Those moments can be intimidating, but they are also where hidden costs and unnecessary care often begin. So, here's how to ask the right questions before you schedule anything. Now, if your doctor recommends surgery from a specialist or a procedure, ask these questions. Is it urgent? Can it wait? Do I need a referral for my plan to cover this? Requirements vary by plan. And can you refer me to an in network provider or facility? Again, that will save you a lot of money in the long term. And here's an example. Susan's doctor suggested minor surgery for carpal tunnel. She asked if it could wait. The doctor offered a brace and exercise first. No surgery needed. So asking is very important to get alternatives to more expensive plans, prescriptions, and things like that. Now, here's a pro tip. If a plan requires a referral, make sure that it's on file before the appointment. Some referrals expire 30 to 60 days after. Now, did you know seeing an out of network clinician provider, even inside an in network hospital, can add hundreds of dollars or more to your bill? Always confirm the network status for both facility and clinicians. Very important. It's okay to ask for time to check coverage and explore alternatives. Again, you are in control. Now, have you ever left an appointment feeling like you were just rushed into a medication or testing before talking about any other option? Sometimes the best solution isn't the fastest. It's the one that fits your life and your budget. Remember that. That's where asking about alternatives can completely change the care plan. So, doctors are trained to solve medications quickly. Sometimes that means jumping to medications or tests. There are often simpler and cheaper steps first. Now, ask these questions. Are there lifestyle changes that I can try before starting medication? What's the most cost effective treatment that still works? And can we start with the least invasive option first? Now, here's an example. James had a mild blood pressure. He asked about diet, exercise, and a home blood pressure tracking before medication. With a follow up plan, his numbers improved without starting a drug. And if medication is needed, you can still ask, what happens if I wait short term? Is this urgent? And also, are there any treatments people usually try first? Now, you don't have to be an expert. You just have to be curious, and curiosity leads to clarity, and clarity saves money. Now, have you ever felt like you didn't want to bother your doctor with too many questions? I know I've felt like this before. Or maybe you wanted to ask once the visit started. You want to ask something, you didn't, you felt, intimidated or something, and you forgot. That happens a lot. The way you ask can make all the difference, not just what you ask. Now, before we go to the next slide, this course also challenges your belief system. We have a belief that we cannot ask the doctor anything because it's challenging them, right? You have to remember you're the one that takes the medication, you're the one that pays the bills. You have to have an active role in what's going on, and it can feel intimidating. I remember I went to a couple of doctor's visits with my mom, and she didn't know how to ask the right questions and speak to the doctor. I speak to doctors all the time, so I was doing some of the talking for her, but you have to take control of your care because a lot of people don't have people that can talk on their behalf. All right, so pro tips for asking effectively. Number one, write questions down ahead of time. It keeps you focused. Two, be polite and direct. I want to be sure I understand why this test today, why this procedure, why this plan of action, etc. Asking the right questions will help a lot. Three, say if you don't understand, can you explain that in plain language or give me an example? And these doctors are highly educated, been in training and doing this for years. So it may be so simple to them, but very complex to us. So we have to ask them to break it down in layman's terms so that anyone can understand. Four, be honest about the cost. Say, I'm worried about the cost. Are there any lower cost options that still work? And five, use the time. If the visit feels rushed, say, I still have two quick questions. It's okay to use time that you're given. And how you ask matters as much as what you ask. So, for example, when Priya told her doctor the prescription was unaffordable, he switched to a 90-day generic at a discount pharmacy, saving about $600 a year. Good clinicians and providers welcome good questions. It shows you're engaged in your care. Now, have you ever said yes just to wrap up an appointment, even though you weren't sure that you agreed to? It happens all the time, but it can lead to unnecessary stress, cost, or confusion later. Here are some of the biggest mistakes to watch for and how to avoid them. So watch for these traps. Asking too late. Bring key questions up early, not at the door. Not taking notes. Relying on memory leads to confusion. Avoid money talk. Your clinician doesn't know about your budget unless you say so. And saying yes out of fear. It's okay to say, let me think about that and check with my insurance first. Now, here's an example. Darren agreed to extra labs without asking why. The test added $500 and it turned out everything was normal. One question, do I need these today, could have saved him hundreds. It's your body, it's your money. You have every right to ask. So it's easy to forget everything in the moment. What if you had one simple list to keep you on track during your visit and keep you right in your pockets? Here's a question checklist to help you, and save this to your phone. For tests, ask, why do I need this? What will the results change? Are there simpler or cheaper options? For prescriptions, is there a generic? How long will I take it? Are there non drug alternatives? For procedures and referrals, is it urgent or can it wait? Do I need a referral for my plan? Can you refer me in network? For cost and communication, can you explain that in plain language? What's my total expected cost? What should I do if symptoms don't improve? You don't have to ask them all. Pick the ones that fit today's visit Even good questions can change the outcome. So, have you ever wondered if asking just one question could really make a difference? Let's look at an example that shows up how powerful asking can be. So, the power of asking. Before Sarah had a stomach pain and didn't ask questions, left with two prescriptions and paid $220. After that visit and experience, she asked why this medication and is there a generic? One drug turned out to be optional, the other had a $15 alternative. Same condition, far lower cost. Every thoughtful question brings you closer to clear, affordable care. So, when you think back to your last appointment, which questions did you wish you asked? These are quick reminders to make sure you're ready for next time. And before we go to the next slide, I just want to talk about I had an experience like this. I went to a doctor that I knew, and he was trying to get me to get a shot and another test, but I asked them like, is this needed now? And it was completely optional. But you have to remember, some of these tests and some of these things they're trying to order for you, labs and different stuff, some of it's tied to their revenue and salary. So you also have to just make sure that the options that are given, if it's necessary or not. So pro tip roundup. Number one, ask about necessity, timing, and alternatives for tests. Two, ask about generic versus brand prescriptions. Three, confirm referrals and in network coverage before scheduling. Four, ask for plain language explanations. Five, be upfront with cost and comfort level. And again, I'm saying these over and over again because when you go to the doctor's office, it's easy to forget them. You feel overwhelmed. You feel like they're busy. You don't want to bother them. And so, getting these questions and how to talk to them into your mind, into your subconscious mind, will allow you to speak with confidence when you go in there and be prepared. Asking questions doesn't make you difficult, it makes you informed. So, how confident do you feel about speaking up in your next visit? Remember, you don't need to ask everything perfectly. You just need to start asking. Closing and next module. Asking the right questions puts you in control of your care, your time, and your wallet. Next, we'll go deeper on avoiding overtreatment, how to recognize when more care isn't better care, and the red flags that signal you might be paying more than you really need. See you in the next module.